Hello, my name is Jessica Jackson. I am a Year 2 Certificate of Higher Education PBB student, and I am going to speak to you today for my Giving Birth module. I'm going to be looking at a form of pain relief, and today I'm going to speak to you about epidural. What I want to cover here essentially is what the experience of epidural might be like, and just give you a little bit more information to assist you on making the decision as to whether it's the right form of pain relief for you. Now, epidural actually is not the name of the drug that is used in epidural. The drug is called fentanyl, but the epidural refers to the place where you receive the drug epidural. And I have an image here that I can show you. So you can see here that the epidural space is actually a space just behind the spine. And in order for you to have an epidural, an anaesthetist actually has to give you the epidural because it is an injection into the spine. The anaesthetist may or may not get the right place initially, so you need to be aware that it may take a couple of tries to get it into the right space. And because it's an anaesthetist that has to give you the drug, it can only be in a delivery suite. You wouldn't be able to get it, for example, on a birth ward or at home. Now, there are various other things which would need to happen alongside having the epidural injection. You would need to be on what we call continuous monitoring for both you and the baby. And why you would be monitored is so that they could see when you are contracting, because potentially you wouldn't be able to feel your contractions. And also they would want to monitor the baby's heart rate. So this is what continuous monitoring may look like. You can see there are two straps across the stomach there, and that is in order to monitor the contractions and the baby's heart rate. And there's a closer up image here. And you can see in this image that the mother is actually sitting upright. So you don't actually have to be completely lying on your back the whole time if you have an epidural and are being monitored. The other thing that you would have to have is an IV drip. The reason for this is that your blood pressure can be effective and lowered by an epidural, so you would be on a continuous drip. And dependent on the effect of the epidural, you may also have a catheter fitted, because you may also lose bladder control. So all of these things are extra to be aware of if you have the epidural. And you can have an epidural which is called a mobile epidural, which enables you to move around more than traditional epidural, which I can cover a little bit more. But even if you do have that mobile epidural, bear in mind you would still be hooked up to the continuous monitoring and to the drip. So whilst you would be more mobile than if you'd had a higher dose, which is what the mobile is a lower dose, you wouldn't be able to sort of leave the room and go for big walks, because you would have these other things strapped up to you, as it were. So what are the major benefits of the epidural? Well, what it does is completely numb the bottom half of the body, and I have an image here which can show you the actual area of numbness. You can see there in the blue. And obviously, when it is completely numb like that, you are not going to feel the pain. And for many women, that is the major attraction of the epidural, is that you are not going to feel that pain of labour. Like I say, you may not be able to feel the contractions. Now, with the mobile epidural, this is a lower dose anaesthetic. But again, you don't know for definite whether that is going to enable you to be able to move, because the epidural traditionally means that you wouldn't be able to move around as much. You wouldn't be able to walk, for example, because you're completely numb from the waist down. But obviously, some people feel that the major benefit, to not feel that pain of labour is absolutely the right thing for them. So are there any drawbacks to an epidural? Well, there are potentially some drawbacks. Because you are more likely to be sitting or lying with an epidural, because you're not able to walk and move around, this can increase the labour time because you haven't got the assistance of gravity to help the baby down through the pelvis. You haven't got the assistance of an upright position, which can help increase the strength of your contractions and push the baby down. Also, the epidural relaxes the pelvic floor muscle, and it's the pelvic floor muscle which enables baby to move the smallest part of its head and shoulders through the widest part of the pelvis. And without the assistance of the pelvic floor muscle, the baby may not make the turns that it needs to make in order to have that smallest part go through. And this can in turn result in a more assisted labour at the end, a more assisted delivery of the baby, an assisted birth of the baby with either a ventouse or forceps, because the pelvic floor hasn't been able to help as much. There are also some possible side effects which can include nausea, dizziness, shivering, itching. Some women experience a severe headache, and there is potentially some back pain. Again, dependent on how you react to the drug, you may or may not experience the side effects. So I think the last thing we need to say is that ultimately, if you do have the epidural, it's still important to try and move around as much as you can, because we mentioned there about the movement restricting baby's path. But if you can still move around, turn onto your side, sit upright like the picture I showed with the monitoring, and just shifting around on the bed, this is all going to assist baby's path and make sure that the birth is easier for you. Ultimately, now you have the information, be happy with your choice. If you do go for an epidural, it's absolutely fine, it's absolutely fantastic, and it was the right thing for you. You need to feel confident and happy with that choice. You can also have massage, because you may not be able to feel from the waist down, but you can still feel from the waist up, so your birth partner can be there to help massage and relax you. And also remember to breathe and increase the oxygen supply to both yourself and to baby. Thank you very much. Bye-bye.